It's infinitely positive. Cardiac rehab helps you feel better, and there's a lot to be said for that, and do better.
Well, cardiac rehabilitation has given me my life back. I'm back doing things I didn't think I would do anymore, and I'm doing them better.
Even though we gained an awful lot from it and it was transforming, even if none of that were true, I'd nearly attend for the social aspects of it because it was very, very enjoyable.
If you keep doing what you're told, I mean, you'll be out the gap big time, you know, so I would recommend it to anyone, I really would.
The main people who are eligible for cardiac rehabilitation are people who've just been discharged from hospital after a heart attack, just been discharged from hospital after a stent, just been discharged from hospital after a bypass, or just been discharged from hospital after a diagnosis of or an admission with heart failure.
Not only does it help them live longer, so not only is there an actual mortality benefit, but it also decreases the amount of times these patients are likely to come back into hospital. It improves their symptoms, improves their exercise tolerance, and also improves their quality of life.
When you first come in, you have an assessment, and the assessment involves a fitness test. Don't worry, it's at your own level. You'll be put at your ease. It takes probably about an hour. You meet the nurse and the physiotherapist, and then you join the exercise training classes. It's a friendly, welcoming environment. You'll be sitting with other people who've had the same event. They're all feeling a little bit nervous, just like you. And I can tell you, after one session, all those nerves are gone.
As well as looking at improving one's fitness and getting them exercising, cardiac rehabilitation will also look at other healthy lifestyle, at people's diet, looks at smoking cessation if they're a smoker. It will look at psychological aspects, and it'll also kind of provide them with education around the risk factors so that they can self-manage the condition themselves after leaving cardiac rehabilitation. Every patient who does it never regrets doing it. Patients are always surprised about what they get out of it because every patient gets something out of it. But the main one would be kind of confidence to get back living, to get back exercising, to get back enjoying life.
We talk about the importance of medicines and the impact they have on your cardiac health. We talk about self-care and how to improve that self-care. It's really important that they come because we're here to help them to recover physically, emotionally and socially. And they will really benefit from the programme. They will feel better, they'll feel more confident, and they'll take their place back in their lives as if this never happened.
It's free, it's fun, and it gets you back to your physical health prior to your event. It improves their fitness, they achieve a goal, get them back to their fitness prior to their event. It improves their cardio and their aerobic resistance. A lot of them, I say that you get their confidence back.
It was very welcoming and very open, and they tell you straight out what is happening and why you're here. Because it will probably end up being the fastest 10 weeks of your life. Because now, number one, the benefits that come out of it, but the friendship and the camaraderie you'll find inside here will be second to none.
As when I came here first, I was definitely low in confidence. I wasn't sure even whether I'd be able for it really, but got better and better like as it went on, and you know, I met new people, and there was a good social aspect to it.
Initially I was quite fearful, not knowing exactly what it would be. So at the end of the 10 weeks I was transformed really as regards confidence and feeling good about what I could do in other aspects as well from then on. Oh, I'd recommend it 100%. It was absolutely the best thing that could have happened to me, and I'm sure to everybody else in the class as well.
In general, they're well taken up. We do know that for whatever reason, it seems to be men who are more likely to take up spaces than women. So I would just say there's a very good wealth of evidence there suggesting women benefit equally to men from the point of view of taking up cardiac rehab, and I would encourage all women out there, if they're offered a position in cardiac rehab, to try and take that up. So medication is important, and for patients who've had a heart attack, there always will be some medication that they'll need indefinitely. Having said that, they may not experience a significant change in their symptom burden or in their quality of life from medication, but almost certainly will see an improvement in their symptom burden and quality of life with cardiac rehabilitation. And so for that reason, I would really strongly encourage all patients who are offered a place on the programme to consider taking it up.
If somebody is offered an appointment for cardiac rehabilitation, I would tell them, I'd recommend them 100% to make sure they attend. They won't regret it.
If you get an invite for cardiac rehabilitation, please consider it. Give it a chance. Because it will give you a chance, and isn't that what we all want? A chance at life. At the end of cardiac rehabilitation, people complete another post-assessment where we repeat the fitness test, and then we write to the GP with the results of the fitness test and with the results of how they got on during the programme. And patients are also invited, if they wish, to ring a bell, and ringing the bell signifies that they've reached a milestone and they're now back to getting on with their own life.